I want to welcome everybody to our rally. My name is John Fanning, and I'm a general internist here in Huntsville. About 2 or 3 months ago, I would not have done this. I am not someone who's been politically active in the past, but what I've seen happen in our government, I realized that I had to do something. I had to stand up. And I'm glad that all of you are here to stand up as well and try to fight this thing. First, I want to thank everybody for coming out today. This is well beyond my imagination of who would show up. Realizing that this was something that was put together through emails, through conversations in the hallway at the hospital. I'm just amazed at the number of people that have shown up, and I want to just tell you thank you. Everybody give yourselves a big hand. I want you all to understand that doctors here are not against healthcare reform. To the contrary, we want reform. We all understand the challenges facing Americans who do not have health insurance. The people that understand it the most are the doctors, because we deal with it every single day. President Obama and the Congress, and even our friends across the street in the counter-protest, are for the bill that would have you believe that people are dying in the streets. They want you to believe that if we do not support this bill, that we have evil souls and want people to die. Understand this. Every one of the doctors here, every one, sees patients without insurance. In fact, were it not for the altruism of physicians, patients really would be dying in the streets. Today, you will not hear only about the problems of this catastrophic health bill that's currently in Congress, but fiscally responsible, real-life solutions to our healthcare problems. The point is that we're all affected by this dismantling of the best healthcare system in the world. And that's why we are all here. As your doctors, we are your advocates, your counselors, your cheerleaders, your teachers, and sometimes your parents. Ladies and gentlemen, we are at a crossroads in America. We face a giant government takeover of our healthcare way of life that will, not might, will fundamentally change how we, the patients, will be treated. The Senate is debating this bill even as we speak. The next speaker we have is Dr. Paul Dang. Dr. Dang has a unique perspective. He and his wife Nita Coley Dang both practiced in Canada for 9 years. So I'm going to let he and his wife speak. Thank you.
Good afternoon. My name is Dr. Paul Dang. I'm a hematologist-oncologist here in Huntsville, and we've been asked to talk about our perspective. We've been asked to talk about our perspectives of practicing in Canada and about socialized health care. My wife and I trained in Toronto and practiced in Canada for about 9 years. And it was increasingly frustrating practicing there. And that's why we ultimately moved here. The problem there was that everyone has universal health care. But there's a big difference between having health care insurance and having access to health care. The system there was overburdened, overused, and basically dysfunctional. To get into a doctor's office, especially a specialist, quite often would take several months. We were constantly pleading with offices to see our patients sooner than they could get them in. Tests would take weeks to months to get done. CT scans, MRIs, quite often in that range. I was constantly calling the radiologist to plead with them to get our scans done for our cancer patients in a more timely fashion. We were constantly fighting for our patients. The system would not permit them to be treated in a timely fashion. But any elective surgery took time. If you want to have a cataract done, you'd have to wait 2 years. If you want to have an elective hip operation, you'd live with your hip pain for 1 year before it was done. Bypass patients would be waiting on average for several months to be done. So the system, everyone had insurance. The problem is you couldn't get in to see your doctor, you couldn't get the tests in a timely fashion, and it was always a struggle getting your cancer treatments on time. To pay for such a system, taxes were much higher than what they are here. And not just for the rich, for everyone. It was an overburdened, underfunded system, and it just didn't work. As a result, Nita and I moved here, and we're much happier. To give you some perspective on a friend of ours, that actually a more personal perspective on what happened to one of those patients, I'd like to introduce my wife, Dr. Nita Day.
I wanted to talk about the universal healthcare system that's available in Canada. I wish to reiterate what my husband has said, but on a more personal note. We have a close friend whose sister was diagnosed with breast cancer in Canada. She detected a lump in her breast, and she went to see her family physician. He agreed that this was of concern and referred her to a surgeon so she could undergo a biopsy. The appointment was not until 6 to 8 weeks later. The surgeon confirmed that this did need a biopsy and put her on the waiting list for surgery, which took another 8 weeks. The biopsy was done, pathology came back malignant, and the patient was told of the diagnosis. She was then referred to an oncologist for further treatment. He saw her 2 months later, and this is after we called requesting an earlier appointment. When she saw the oncologist, he arranged scans, CAT scans, MRI, etc., to determine the extent of the disease. That was another 2 months. By the time she had her scans, the cancer had already advanced all over her body. She started chemotherapy there, but became increasingly frustrated and then decided to come here to the United States without any insurance and get the rest of her treatment here. We tried to prolong her life as much as we could, but she died 2 years after the diagnosis was made. Had she been treated in a timely fashion, she could have very much been alive today. This happens again and again and again. A family member of ours also had to be flown down here to have cancer surgery so that he could receive treatment in a timely fashion. And this is after paying 65% income tax for several years. So yes, universal healthcare in Canada is available to everyone, but it is rationed. You have to wait in line. If you die while you're waiting, well, that's just the way it is. Do we want this kind of a health system here? I don't think so. Call your senators and tell them what you think. Thank you.